The Zika virus is a controversial topic in today's news. Women who are pregnant are being told not to travel to South America because there are so many people who are becoming infected down there. So let's find out more about the Zika virus and how it can affect people. The Zika virus was founded in 1947 in the Zika forest of Uganda. It is most commonly spread through mosquito bites but can be transferred sexually. The Zika virus is extremely mild and it is so rare to die from it. The virus is a member of the Flaviviridae family and the genus Flavivirus. It is mostly seen to be spread through the daytime Aedes mosquito, such as the Aedes aegypti or Aedes albopictus. Only 1 in 5 people get sick once they are infected by the mosquito. The symptoms do not last very long and are extremely mild. Some of the common symptoms that people see are fever, rash, joint pains, and red eyes. Like said on the previous slide, the symptoms usually only last up to a week, but since the symptoms are so mild, people do not even know that they have the virus. Once someone is infected by the virus, he or she is usually immune from it after. Up until 2015, it was not seen in the Western Hemisphere of the world. The people who were affected by the virus were in Africa, Southeast Asia, and the Pacific Islands. Then, in May of 2015, there was a known case in Brazil. The United States is starting to have some cases because of the people traveling to those areas. In this graphic, it shows the areas in South America and even in Mexico that are being affected by the virus. Even though the U.S. is not shown as being an active area, it most likely will be soon. The Zika virus is closely linked to yellow fever and dengue that may cross-react with the tests. If someone is believed that they are infected by the virus, then he or she needs to get a blood test taken in the first week. The CDC does not recommend taking antiviral medication to treat the virus. It is recommended for pregnant women who visit an affected area to consult a doctor immediately. Also, even if a woman is pregnant but is not experiencing any of the symptoms of after visiting an affected area, they should still get an ultrasound to see if their fetus is developing microcephaly. It is very dangerous for a woman who is in her first trimester to be infected by the Zika virus. This can cause a birth defect called microcephaly. When a woman is planning on becoming pregnant later in life, there is not a huge risk for their future child to develop microcephaly. The Zika virus is said to stay in the blood for no longer than a week, but it is found to be in semen for longer. If a woman is trying to get pregnant after they have traveled to one of these areas, they should still consult a doctor just in case the virus is still present in their blood. In order to protect oneself against these mosquitoes, it is recommended to use insect repellent that contains DEET, which is the most common ingredient in the repellent. The CDC also says that wearing clothes that covers as much skin as possible and making sure that all windows and doors are closed unless they have screens is the best way to protect against mosquitoes. Making sure that all potential breeding sites for mosquitoes are covered, clean, or empty. A breeding site would be pots, water bottles, and buckets. It is also best to sleep with mosquito nets even during the day because the Aedes mosquito is most active during that time. Now, what is microcephaly? It's a neurodevelopmental disorder that causes the baby's head to be much smaller than what it is supposed to be. What causes the head to be so small is the brain has stopped growing while either the mother is pregnant or can stop developing after birth. About 12 in 10,000 babies in the U.S. are affected by this disorder. This is a good way to show the differences in the head size of a baby without microcephaly compared to a child with the disorder. It's a huge difference in size. Even comparing severe microcephaly to mild and moderate microcephaly, there is a significant difference in the head size. The problems with people with microcephaly have are seizures, developmental delays, and intellectual disabilities. Because their brain is so small, that is the main cause for developmental delays and intellectual disabilities. People with microcephaly also have problems with eating and swallowing, so it makes it common for them to develop eating disorders. They also have hearing and vision problems, as well as a hard time with movement and balance. Unfortunately, there is no specific treatment for people with microcephaly. Doctors can recommend treatment, but that depends on the severity and symptoms of the child. People with microcephaly can lead a very happy and healthy life. They do need supports and help in their daily living, but parents need to be there for their child in order for them to be successful. Parents who promote positivity and independence can increase their child's self-esteem. Right after birth, parents will not be able to tell the severity of their child's condition. They need to let their child develop to see how their life will be.